Welcome to my presentation on the ups and downs of blood sugar, an integrative approach to diabetes. I am a holistic nutritionist, and I am participating in nutrition and integrative health and functional medicine residency at Healthy Ways Wellness Center, 366 Federal Road, Brookfield, Connecticut. A holistic nutritionist is somebody who likes to look at the root cause of disease and tries to promote health, believing that the body has the ability to heal and rejuvenate if given the right ingredients. Presentation today is going to encompass the following: understanding what health is, an overview of glucose and insulin, what it means to be insulin sensitive or resistant, diabetes, diabetes markers, complications, myths, the carbohydrates that are the most healthy for our bodies, an optimal diet to balance blood sugar, takeaways, and references. This information included in this presentation is for educational purposes only. It's not intended to be a substitute for professional medical advice. Please consult with your healthcare provider to determine the appropriateness of this information for you and your situation. What are the ingredients of health? Oftentimes we're focusing on disease and problems, but what promotes health? The first thing is a diet full of whole, fresh foods, getting out in the sunshine, drinking filtered, uncontaminated water, breathing in fresh, good, clean air, exercising and moving and doing fun activities, loving yourself and having other people in your life that you love, making connections, social connections, intellectual connections, connections with friends and family and coworkers. Have meaning and purpose in your life and remove any obstacles that may be in your path to health. Let me move myself here a little bit to this side. Blood sugars go up and down depending on what you eat. When you eat sugary foods and quick carbohydrates that turn to glucose fast in your body, then your body responds to that extra sugary carbohydrate foods that turn into glucose with the pancreas secreting an insulin hormone. And insulin is like the ticket. It gets that glucose that's excessive, high in the blood, into the cells. And the cells use that glucose for energy. If you eat the right amount of glucose and use it for your energy that you need, then things are fine and balanced. If you eat excess glucose, the first thing that happens is your body stores it as glycogen in the liver and a small amount of glycogen in the muscles. But most excess glucose gets stored in the fat cells. Glucose gets put into the cells or used for energy, and then blood sugar levels drop, and that promotes hunger, prompting you to eat more quick, sugary foods, quick, simple carbs to get that blood glucose up higher. And the cycle goes on and on. So look at this diagram for a moment. This big blue ball is your cell. And the receptor cells that the receptors for glucose are around the cell membrane. In order for the glucose to get inside the cell, we need that insulin. It's like a key and opens the door, so to speak, for glucose to get inside our cells. We want our cells to be sensitive to insulin. That means we want them to respond. When insulin, the key of insulin opens up that receptor spot, we want glucose then to go into the cells. And then the glucose can be used for energy. We hope that we won't need a whole lot of glucose. Our glucose levels are balanced. We won't need a lot of insulin to get those into our cells to help us have the energy that we need. But oftentimes things get a little bit wonky and our bodies become insulin resistant. That means that the pancreas might not be responding by sending enough glucose or enough insulin into the body. Or we might have so much glucose that the pancreas can't keep up with it. And the body becomes resistant to insulin. In other words, when those cells need glucose, insulin is not able to take that key and open up that door and let the glucose into the cells. So what happens is that our glucose levels in our blood rise, our cholesterol gets higher, our triglycerides rise, and we have what's considered chronic inflammation in the body. Look at this diagram for a moment. On the left side, you will notice how the insulin is normally. There's a cell, it needs glucose, there's glucose in the blood, insulin opens the door and allows the right amount of glucose to get into the cell. But when we become insulin resistant, when our cells become insulin resistant, it doesn't work quite right. There might be two different scenarios going on. One is that there's lots of glucose in the blood, but the insulin isn't allowing it to get into the cell, and so we're tired, we're fatigued, we don't have the energy that we need. Another paradigm may happen where the insulin is opening that door to the cell, but too much glucose is getting into the cell. Then we have blood sugar issues. So let's talk about these conditions for a moment that you've heard of, prediabetes and diabetes. Prediabetes is when the blood sugar levels are a little bit higher than normal. They're not quite in the diabetic range, but they're just not responding in that normal way. The body's producing insulin from the pancreas, but maybe it's not quite getting all of that glucose out of the blood as quickly as it used to. There's usually no symptoms attached to prediabetes, but it should be noted that about 2/3 of the people come into the emergency room with a condition, a heart condition, or having a heart attack, that they are pre-diabetic or they have undiagnosed diabetes. Prediabetes and diabetes increases your risk for chronic disease, and we'll talk about that more later. So diabetes is when there's too much glucose in the blood. Either the pancreas isn't secreting enough insulin to get that glucose into the cells, or the cells have become resistant. And symptoms start to be manifest. The skin can become a little bit dark, folds of the skin under your arms, places in your neck or under folds of skin can become darkened. You have almost an insatiable amount of thirst. Your body needs to be hydrated more. You are urinating a lot more frequently. You might have sleep issues. You might have neuropathy. You might have troubles with your liver or kidneys, or your wounds might be healing slowly, and you might develop some foot ulcers, blurred vision, and your chronic disease risk is increased. There are two different kinds of diabetes. There's type 1 and type 2. Type 1 is an autoimmune disease. An autoimmune disease is where your immune system isn't functioning properly, and instead of attacking pathogens, bacteria, viruses, things that get into your body that your body doesn't need, it starts to attack your own tissues. So in the case of type 1 diabetes, the immune system is attacking the beta cells in the pancreas. And so the pancreas isn't able to produce insulin. And that means that insulin needs to be brought into the body either by injections or by a pump, because insulin is needed, as we noted earlier, to get glucose into the cells for energy. Most diabetics are in the type 2 category. They have been diagnosed because of an imbalance in their lifestyle practices or their dietary practices. They oftentimes will have excessive body fat, oftentimes around the middle, and the glucose and insulin mechanisms are not functioning properly. It usually takes a long time to develop, up to 10 years. And the main root cause is excessive carbs and sugars that create a challenge for the pancreas, and it just gets exhausted. It can't keep up with all of the glucose, the intake of glucose. But the pancreas can recover by reducing body weight and by helping the cells become more sensitive to insulin. I like this cartoon. It's cute. Diabetes became an epidemic about the same time people started using the internet. Too much spam and cookies from the computers. So what are markers that determine whether you're pre-diabetic or diabetic? Normal markers of hemoglobin A1C are on the left side of this slide, and on the right side are abnormal. So let's talk about these for a minute. Hemoglobin A1C is identifying how much sticky, sugary components of glucose are stuck on those red blood cells for up to 90 days. And if you look, normal is less than 5.7%. Optimal is even lower. And if you are above 5.7 to 6.4, you're considered in the pre-diabetic category. If you're 6.5% or higher, you are diagnosed as a diabetic. Another test that can be done is called the fasting glucose test, where you fast for 8 hours and then your blood is tested. And a normal reading on that test would be 100 milligrams or less. If you're above 100, between 100 and 125, you are considered pre-diabetic. And if you're 126 or higher, you are diagnosed as a diabetic. There's another test called oral glucose tolerance, and it's where you drink a very sweet drink, high in sugars and glucose. Your body has to break down to glucose, and it's trying to see how your body responds to glucose. So you drink a drink, you wait for an hour, and then 2 hours, and they test. Normal glucose at 1 hour would be less than 200. At the 2 hour mark, it would be less than 140. And normal insulin is 30. The oral glucose tolerance test, if you're pre-diabetic, is 140 to 199, and diabetic is 200 and above, and you have out of range insulin levels. When you're diagnosed as a diabetic, your doctor, your physician, will want you to monitor and to see how your body is responding to glucose. And there's several different ways to do that. There's a glucometer, which you see in this picture right here, that you get a kit and you purchase lancets you prick your finger with and get a little bit of blood, and you take a little strip, put that blood on the strip, put it into the glucometer, and it tells you what your blood sugar levels are. There also are arm sensors you can get. There's insulin pumps that can help determine it. So you want to work with your physician and determine how often you should test. And there's a lot of factors that might be involved. But normally, you might test when you wake up in the morning as you're fasting and haven't eaten, test a little before you eat, and test 2 hours after you've eaten, and then again at bedtime. And then keep track of those numbers. As we indicated earlier, diabetes is a condition that has its own symptoms and challenges, but it also promotes complications in other places in the body that can cause some concern. And here are some of them, not an extensive list, but some of the complications that can arise. Non-alcoholic fatty liver disease is where fat accumulates in the liver. Alzheimer's disease, which is a cognitive issue. Cardiovascular disease, high blood pressure, dental issues. Sleep apnea is often commonly connected to those who are diabetic. Chronic inflammation is happening in the body when your blood sugar is out of control. You can have problems with your eyes, with your kidneys, with your liver, with nerve function, and ulcers and several different types of cancer are connected to those who are diabetic. Let's talk about a few myths about diabetes that float out there. That diabetes is genetic. While this might be a contributing factor to type 1 diabetes, it is definitely not the contributor. You can influence the expression of your genes by a lot of different factors, which is a science called epigenetics, which is not something we have time to address in this presentation, but something worth looking at. Most of the reasons why diabetes is on the rise has to do with the foods that we're eating and the lifestyle practices that we have, the environmental toxins that we are exposed to, how we have, the amount of stress we have, the kind of exercise that we do or don't do. All of these aspects influence the development of diabetes more than just being a predisposition genetic factor. Diabetes is not reversible. Again, this is a myth. Diabetes symptoms can be reduced, blood sugar levels can be normalized, insulin sensitivity can be achieved, and it's treated mainly by diet and lifestyle factors. Prediabetes isn't a problem. It's actually a warning, a light, and many of the complications associated with prediabetes can also be seen. With diabetes can also be seen with prediabetes as that chronic disease risk increases. Once you're on insulin, meaning you need to have more insulin to manage the blood glucose levels, that you can't get off of it. And again, that's a myth because you can monitor, reduce, even reverse diabetes through nutrition and diet, and come to the point where you become more insulin sensitive and there's not a need for injections of insulin. Diabetic medications prevent chronic disease. And the other one below that, good treatment for diabetes with heart disease and heart surgery and angioplasticity. Surgery and medications treat the symptoms, but not the underlying causes. And again, going back to that diet and lifestyle can be changed and balanced and help with reversing and reducing the complications and symptoms of diabetes. Weight loss is necessary to diabetes management. Actually, weight loss is critical for health. That's good. Yeah, definitely. And for chronic disease. But if you start to make dietary changes in reducing the carbohydrates that you take in, changing the kind of carbohydrates you eat, and that it will quickly change your blood sugar levels. It will quickly reduce cholesterol and normalize your blood pressure. Eventually, you'll want to keep continuing to lose weight because that will help over the long term. Mark Hyman has written many books on nutrition and functional medicine, and he says this: the quality of the food we put in our bodies drives our gene function, metabolism, and health. It is not simply a matter of your weight or calories in and calories out. Eating powerful gene-altering, whole, real, fresh food that you cook yourself can rapidly change your biology. You will lose weight by getting your systems in balance. So what he's saying is that when you eat good whole foods, high quality foods that you cook and know how they're made and what ingredients are added in there, that has a powerful effect on your health and on your gene expression. The type of carbohydrate matters. We talked a little bit about earlier on that there are certain carbs that convert to glucose very quickly in the body. And those are high sugary foods and refined carbohydrates. Eating whole foods, as Dr. Hyman mentioned, and having a good source of healthy carbs in the diet can change the dynamics, meaning whole foods are rich in nutrients and they have fiber, and those two things can help stabilize the blood sugar. They are converted to glucose at a slower pace. Low carb diets are good for diabetics and pre-diabetics, and good choices again include whole, organic, real foods, low glycemic vegetables and fruits, and we'll talk about those in a minute. Some starchy vegetables, and occasionally legumes and beans and non-gluten whole grains, nuts and seeds. And poor choices, and that's because these foods convert quickly to glucose, and then your body has to manage that with insulin. It's sugary drinks, fruit juices, white bread, pastries, cookies, cakes, ice cream, candy, French fries, chips, crackers, well, you get the idea. Processed, convenient, packaged foods. So we want to have carbohydrates that are going to take a long time to convert to glucose in the body. So there's less need for insulin, insulin response. Those are low glycemic foods. Low glycemic vegetables, which include non-starchy vegetables like broccoli and asparagus and spinach, greens, bok choy, and many more. There's lots of lists that can help you learn what those low glycemic vegetables are. You want to have low glycemic fruits, only a few a day, because fruits still have fructose in them, which converts to glucose more quickly than vegetables do. So 1 to 2 daily servings of berries and fruits that have stones or pits in them, and apples and pears. And then occasionally have legumes and beans, non-starchy, high glycemic vegetables like sweet potatoes, and non-gluten grains like quinoa and brown rice. So there's 2 formats of glycemic foods. There is glycemic index, which means that they have identified the foods that are high, medium, and low, depending on how quickly they turn to glucose in the blood. So a Glycemic index number of 55 or less are low glycemic foods. Glycemic load is another format, and it not only measures how quickly the carbohydrate converts to glucose, but it also adds in the serving of carbohydrate. And numbers for a glucose load of 20 or less is optimal. I like what Dr. William Davis said. He is the author of Wheat Belly. And he says this: no one becomes a diabetic by eating too many high-quality proteins, too many vegetable omelets, too many salads, too many nuts and seeds, or too many low-glycemic fruits. But plenty of people develop diabetes by eating too many muffins and bagels and cereal and pancakes and waffles and pretzels and crackers and cakes and cupcakes and donuts and pies and more. So the optimal diet for somebody that has prediabetes or diabetes is to have a lower carb intake, but also the healthy carbs that we have talked about, low glycemic carbs. You want to eat real whole foods that are deep in color, that are full of nutrients and phytonutrients, antioxidants. Eating low glycemic carbs is part of an optimal diet. Cooking with fresh herbs and spices, eating healthy fats like avocado oil and olive oil, and coconut oil, refined and organic coconut oil, avocados and olives, nuts and seeds are all good, healthy fats. Eating high-quality proteins like grass-fed meats and wild-caught fish and pasture-raised poultry and eggs. And then healthy condiments. Sometimes this is where we need to start reading our food labels to see how much sugar is in some of those condiments, and choosing ones that have organic ingredients or that are very low in sugar, or even making them yourself. There's a lot of recipes out there about how to make salad dressings. Make them with olive oil and lemon and herbs. You might want to consider intermittent fasting as part of an optimal diet to balance blood sugar. Intermittent fasting is an example of that would be where you would eat all of your food for the day within an 8-hour period of time and then fast for the remaining 16 hours. And when you do that, it allows your body to rest and rejuvenate and renew. It doesn't require insulin because you're not eating. It allows you to use up some of your storage, your glucose storage of glycogen in your liver and your muscles. And if you use those up, then it will go to your fat and start burning fat. And the lastly is to be healthy and promote health and balance blood sugar levels is to avoid sugar and processed foods, as we have already acknowledged earlier. We're here to help at Healthy Ways. We have information that can help you with understanding the glycemic index and the glycemic load. We have menu plans associated with those foods. We can help you monitor and support you as you try to make healthy changes in your diet and in your lifestyle to lower those blood sugars. So takeaway today. We want to get rid of some old habits, and we want to develop new habits. Diabetes is a progressive disease. It tends to require more and more medication over time to control glucose levels, and eventually diabetic complications can develop. However, it is possible to fully control the condition, even reverse type 2 diabetes and prevent diabetes' harmful effects, or even reverse damage that has already occurred. Focusing on the overall health of the body, including the mind and the spirit, the natural modalities like nutrition, which has been our focus in this presentation today, exercise, sleep hygiene, stress management, environmental detoxification and support, which we have not focused on in this presentation, but will be focused on in part 2 of this diabetes presentations, can balance our blood sugar. Diabetics can have energy and health to live their life fully and completely. And that comes from Master Your Diabetes book. Here are my references for this presentation.